This episode of Precision Opinions Live is brought to you by Vintage Labs. Vintage Labs is a professional-grade supplement and cosmetic company where each product is tested and reviewed by one of their exclusive pharmacists. Look for the pharmacist's signature on every package that ensures that the active ingredient falls within 5% of error and does not contain arsenic, lead, cadmium, or mercury. We welcome you to join the Vintage Labs collection, where they do the research for your health. Use promotional code LIVE, that's L-I-V-E, to receive a 10% discount on all orders at vintagelabscollection.com.
Precision Opinions Live, and my name is Stella, and today I'm actually here with Dr. Ebrahim Sadighim. Thank you for coming on. I appreciate it. And what we're doing this month for mental health awareness is we're actually putting out a couple of videos that will be displaying different topics of mental health, and each video will be donating to NAMI. For one view will be actually equivalent to $1 amount. So thank you for joining us. And Doc, thanks for coming on. I know your background is extensive in ketamine. So now, ketamine therapy, you did a little bit, you're actually a member of ASKP3.
Yes, I am.
Okay, you did that. You got your certification from ketamine and relative compounds?
Yes, in a different conference.
Conference, okay, yeah. Awesome. And you have your office that is in Great Neck, and that is Ketamine Centers of Long Island. Is that correct?
Long Island Ketamine Center, yeah. And the name of the website is longislandketamincenter.com.
Okay, awesome. Well, thank you for coming on. I really appreciate it.
It's a pleasure to be here.
So, let's get into the nitty-gritty as far as depression goes. We know that ketamine is being used for depression, it's hitting the NMDA receptor. Why did you officially get into depression?
Good question. As you know, I am an internal medicine specialist, and I have been practicing for more than 30 years. And I remember the first years when I was practicing, the people who came to our clinics were complaining about some problems that were not really related to physical problems. For example, shortness of breath, chest pain, headaches, migraine headaches, and some other symptoms. After evaluating the patient and doing the test and all kinds of the imagings and everything, we found out that they don't have any really physical or medical problem. So I started reviewing them and did many interviews with them, and I found out that they had depression disease. And they came to the internal medicine office with the symptoms that were really related to depression, but they thought it was a physical problem.
They thought it was like a cardiac issue.
Exactly. The patient came with palpitation, with heart pain, with abdominal pain, headaches, and as I told you, shortness of breath and many other things. Then I started researching, and I found out about 15% of the people who go to internal medicine doctor have depression disorder. Mm-hmm. It's a great number, 15%. So that's why I was interested to catch these patients and make the correct diagnosis of depression and treat them for depression disease, not for the physical problems.
Mm-hmm. Yeah, so I mean, the way I explain it to most people is if you have a loved one, most people within their inner circle, they have a loved one that is suffering from anxiety and depression. It's
yes.
pretty extensive, especially after COVID. So treatment for depression, what's out there and what is going on right now and what is kind of like newer, you would say?
Good question. First of all, I wanted to talk about depression. Depression is a disease that many people are suffering from that, and it has different symptoms like depressed mood, like anxiety disorder, sleep problems, appetite problems, weight problems, and feeling guilty and suicidal thoughts. And that's why this disease should be treated as soon as possible in a correct way. The treatment for depression, about 50 years ago, the treatment was by the medications that they had a lot of side effects.
Like the tricyclic antidepressant.
Like tricyclics, TCAs. I remember when I started my practice, I had some patients who were on these medications, a lot of side effects, and they couldn't tolerate it. And a few years later, SSRIs and the new medications came to the market with less side effects, but still they have enough side effects that the patients refuse to take it. Like, you know better than me, dry mouth, confusion, drowsiness, sexual problems, GI problems. Anyway, the patients had to take this medication. But the other problem is, because of its side effects, many people even don't want to take these oral medications. The people who have depression is interesting. About 30% of them don't know that they have depression disease. And the 70%, they know they have depression disease, they go to a doctor, and about 30% of these people quit to taking medications because of the side effects. And the 60% who start treatment, half of them don't respond to the oral medications at all. So only 30% get benefit from that. And that's why after the ketamine came to the market,
so that's what I wanted to ask you and discuss. When did you get into ketamine therapy? Because I know it's newer. We have a brand name medication that's out there.
Yes.
So when did you learn about it?
Yeah, about 10 years ago, I heard about it. And a few years ago, after FDA approved the nasal spray, I thought, so it's the time to start treatment with ketamine. But I started infusion of ketamine. I went through many conferences, and I got a lot of experience over there. And then finally, I opened my office for ketamine treatment. And I'm so happy that I'm doing that, because many people get the result of that, and especially the people who don't respond to the oral medications, or they don't want to take oral medications for the side effects.
Okay. So we spoke about kind of depression and what depression is and what it does. Mm-hmm. What can ketamine be used for other than depression? Is it just limited to depression, or is there other things that we could kind of tackle with it?
No, ketamine has many different effects. It is used also for bipolar disorder, for anxiety disorder, for OCD, for PTSD. And another thing that is very interesting and is new, they are working on that. is treatment for postpartum depression. You know,
Really?
it is, yeah,
I did
it
not
is
know that.
common. It's common, and after the delivery, the woman gets depression, and they start treating them. But now I read an article recently. They are working on treating all the women after the delivery for prevention of depression. They want to give
Really?
ketamine to all of them to prevent depression. So we are not going to have a postpartum depression anymore.
That's interesting.
Yeah.
Because we use a bit of progesterone in the pharmacy for postpartum.
Yeah.
But to hear ketamine, it's just more research coming out every single day.
Yes, it is. And the other benefit of ketamine is for physical problems, like pain management, chronic pains, migraine headaches, nerve pains, chronic nerve pains, and also fibromyalgia. You know, it is very common, and ketamine works for that.
Yeah, and then there also we hear of CRPS, which is huge. And that's ketamine could be one of the only medications that will give a patient
relief. It works very well, yeah. And I had a patient with ankylosing spondylitis. All of the medications he used, they didn't work. And after ketamine, he was very comfortable. After the first session, he said, after a few years, I don't feel pain anymore.
That's what it's about. Yeah. So talk to me. I know you got a bunch of books in front of you.
Yeah.
What I know that this is in there. What's going on with mechanism of action? As far as how it works.
Yeah. You know, the cells of the brain are called neurons. And neurons have connection between them. And there is a space between the neurons is called junction or synapses. There is a chemical in the brain is called glutamate. It blocks a receptor in the nerve cells that is called NMDA receptors. And ketamine works exactly on that receptor, NMDA receptor, and blocks that. And after this blockage, the proteins in the synapses regulate themselves, and it causes the repair of the filaments of the nerve that they have been already damaged from chronic stress and other things. So when the patient has depression or other psych problems that I mentioned, these connections are ruined, and the cells cannot connect to each other. The medication that we were using before just worked temporarily. For example, SSRI works 24 hours, and after you discontinue that, the effect waits after a few days. But ketamine repairs the connections, and that's why the effect of that is much more longer, sometimes 6 months, 1 year, and they come for the booster.
Yeah, so right away, it's working, and it's decreasing inflammation too, which is something that those medications aren't necessarily doing. And I like to, I don't, not that SSRIs are bad or SNRIs are bad, it's just ketamine works in a different way. I don't like to talk bad about the medications that have brought us to this point. You know what I mean?
Exactly. But most of the indication of ketamine is for TRD, treatment-resistant depression.
Exactly.
It means the people who have been taking medication, oral medication, and they haven't worked, then the psychiatrists usually send them to us for treatment with ketamine.
Awesome. Yeah. So now every medication isn't perfect. Ketamine isn't perfect. It does have some side effects.
Yes.
Explain those.
So, yeah, ketamine has some side effects like anxiety, dizziness, nausea, and also hallucinations. And sometimes blood pressure goes up. And also a state that is called dissociation. But fortunately, all of these side effects happen during the period that is sitting in front of me in the session. The session usually takes 45 minutes, IV infusion, and everything happens during that period, and we are there. If the patient gets anxious, we give medication to them. If they get nauseous, we put a tablet on their tongue. And if the blood pressure goes up, we treat it right away. We have everything in the office to cope with all of the side effects. And dissociation is a state that the patient feels goes out of their bodies, and is a kind of feeling floaty. And they say we see ourselves from outside of the body. It's interesting. And anyway, that is also temporary. And after the session, we keep the patient for another 20 minutes under supervision. And when they go to the normal state, they go home. Some of these side effects take longer, like sedation or sleepiness. That's why we tell them to go home and take a rest until the day after.
Okay. Yeah, it's interesting because this is the first time that a medication in this field has been used like this, and the doctor is physically observing the patient as they're having side effects, which the medication is safe, but you also have the physician observing the patient, which is really nice.
Exactly.
Yeah. How long does it usually, like, how many times are they coming to the office to do this? Like, explain how long it takes, in other words.
Okay, Christian, your questions tell me that you have a lot of good information regarding psych problems and also ketamine. Usually the patient comes to the office for 6 sessions. Either 2 sessions per week for 3 weeks or 3 sessions per week for 2 weeks. As I told you, it takes every session takes about 40-45 minutes plus 20 minutes to be under supervision. Then somebody takes them home. The people, regarding the effect, some of them feel the effect after 24 hours. They say, oh, my depression is gone and I'm okay. Some people after 2-3 sessions, and some people don't feel anything until they finish all of the 6 sessions, and even sometimes 2 weeks after that. And about only 60% of the people respond to ketamine. And these responders, sometimes they are good for 3 months, 6 months, 1 year, but some of them need boosters. They come after 1 month, 2 months, they say, I think I need another injection. And it is going to be only 1 session as a booster, and they get better, and they go for another 3, 4, 5 months, and they come back.
Oh, wow. Yeah. Okay. Now, forms of ketamine. That's the last question I have for you.
Yeah.
Forms. What kind of, when you say go to the office, usually it's an infusion, but what are some other kinds?
Yeah. There are many kinds of ketamine. One of them is spray. This is the one that has been approved by FDA. It's called Spravato. And it comes in 2 doses only. The other one is IV that I explained to you, IV infusion. I do that. The other way is IM injection. The other form is oral medication, oral ketamine, like troches, that the patient puts under the tongue and it gets absorbed in the mouth. And I prescribe this medication usually from Precision Pharmacy, and I have got the result of good results from that. And the other way is suppository. And I read new articles about the other ways. They are making a pump for that, ketamine pump. like ketamine, like insulin pump.
Wow.
Yeah, it infuses ketamine continuously to the body.
So much new.
Yeah, and
new
the other
information.
one is subcutaneous, like subcutaneous insulin.
And you know what? I heard about that recently. Actually, like it slowly releases into the bloodstream.
Yeah.
Which is interesting.
Yeah.
So much new information.
Yes, it is.
But yeah, well, thank you so much for coming on. I really appreciate it.
My pleasure. Thank you for having me.
Yeah, no, anytime. Let's give the viewers your information as far as where to find you, your email, your phone number, and we'll leave from there.
Yeah, as you said, my office is in Great Neck, Long Island, and my telephone number is 516-466-1910, and my website address is longislandketamincenter.com. Mm-hmm. And I also wanted to show some books. The first one is for the patient. It's a good book for the patient before they start ketamine treatment. And the other ones are good for the doctors and providers. This one. This is another one. And this is the last. Actually, there are many good books regarding ketamine, but I usually study them, and these
what we'll do is we'll put the link for the viewers of these books so they can check this out. But
very good,
Doc, thank you for everything you do for all the patients out there in Long Island, and we'll have you back someday.
Thank you very much, and again, thank you for having me.
Thank you for viewing Precision Opinions Live during Mental Health Awareness Month. Hope to see you soon.